Hello. So good to know you could tune in to CRBC Radio 105.5 and listening to the program Healthy Lifestyle Africa. Healthy Lifestyle Africa is a program put together by Asiuko Diagnostic and Medical Center located at Mary Slessor Avenue right here in Calabar, Nigeria. In this edition, we'll be looking at hepatitis and lifestyle. Hepatitis and lifestyle, and as usual, I have an expert here in the studio, Mr. Sunday Clement. You're welcome to the program, sir.
Thank you for having me.
My name is Erim Ega. Join us.
Tune in to Healthy Lifestyle Africa on 105.5 Paradise FM Calabar every Friday at 9 a.m.
Well, Mr. Sunday Clement, let's go straight to the matter on the table. That's hepatitis and lifestyle. Firstly, let me begin by asking you, what is hepatitis?
Okay, hepatitis can simply be described as inflammation of the liver, and sometimes it could be self-limiting, and at times it could proceed to become a cirrhosis of the liver, which is another condition. It can as well proceed eventually to become liver cancer. Mainly, we have about 5 types of hepatitis. We have hepatitis A, B, C, D, and E, which are common around us. So these are what hepatitis is about. It's just a kind of inflammation of the liver.
Okay, very well. But I would have thought that we maybe look at the various types of hepatitis and then link it up to lifestyle.
Okay, hepatitis A, for example, it's also called HAV. It's present in the feces of an infected person. It can be transmitted through water or fluid being contaminated by the virus. If you live in a kind of environment whereby the drinking water around you is kind of contaminated by anyone who has hepatitis A and goes there and defecate, and you come in contact with such water, there's a tendency for one to have the virus. And this hepatitis A can as well be transmitted through sexual intercourse. So when you come in contact with someone who has it, then you can as well have the infection. And sometimes it could be through exchange of needles or maybe through blood transfusion. Anyway, one can get it through, contaminated fluid or blood. So that's usually ways you get
the mode of transmission.
Yes. We have hepatitis B virus 2, which is the HBV, and it's transmitted through exposure to infected blood, semen, and other body fluid, just like you have it in hepatitis A. So hepatitis C is mostly transmitted through exposure to infected blood. So this may happen through transfusion of HCV contaminated blood product, contaminated injections, through medical procedures, through injection, drug use. Some people like taking all these narcotic drugs, and when they take these drugs, they use injection. They use through the IV. When they use the needle, they pass it on to their partner in crime, and the other person also, without minding, would as well use the needle. So that way, people have hepatitis C being infected. So hepatitis D, which is the HDV, infections occur only in those who are affected with HPV. So when you have someone who has hepatitis B, there's a tendency that the person can as well have hepatitis D. It's a dual infection and can result in more serious diseases.
You're listening to Healthy Lifestyle Africa, a program that gives you information on how to prevent diseases.
Okay, thank you very much for that great insight. We're looking at hepatitis and lifestyle. So what kind of lifestyle would one adopt to avoid hepatitis? Or before we get into that, the lifestyle that could lead to hepatitis?
To start with, when people talk about hepatitis, it doesn't sound so scary like when you talk of HIV. So, and I would say that even HIV is more popular than hepatitis. That is socially. Now, if someone has HIV, almost everybody in the room will run away. But when you say hepatitis, people feel.
It sounds very mild.
It sounds milder than
Meanwhile,
HIV.
it's very dangerous.
Yeah, it's also a virus. So usually transmitted through sexual intercourse, and it's very, very common. When unmarried couples have sex, these boys and girls, what they have in mind is just to use condom to protect themselves from having HIV virus. But sometimes, they have unprotected sex, and they have high chance of transmitting hepatitis. So it's not only HIV people need to put in mind when it comes to sexual intercourse. They need to put in mind that, look, you can as well contract hepatitis. So that is a lifestyle. When you are so promiscuous, you go around with boys, you go around with girls, and you feel, it makes you feel, you're a big boy, you're a big girl, and all that. So you should bear in mind that you stand a chance, high risk of contracting hepatitis, and it's a very, very stubborn disease, to get rid of, and quite expensive, as well to cure. So it's very important that if you have such lifestyle, you have a tendency to have it. Then secondly, if you take drugs, if you have a lifestyle of taking drugs, you risk yourself being contaminated somehow.
Taking drugs without doctor's prescription?
No, I mean IV drugs.
Okay.
Most people that take narcotic drugs, they use these things. They inject themselves. And when they are done with the needle, they pass it on to someone else. The syringe and the needle, they pass it on to someone else, and other person uses it as well. So you stand risk of having the virus into their system. And people who do tattoos, you get to do tattoos, and eventually you have bleeding, and they use unsterilized equipment on you. You stand a chance. And some people who have a lifestyle of cosmetics, I'm so mindful of my shape, I want to do this, I want to cut this, so in the process of working on you, to remove acne, to there are a lot of techniques now that ladies do, to make their skin more smooth, and sometimes they could have bleedings and all that. If the equipment are not well sterilized, they have a high chance of eventually having hepatitis as well. So these are ways of contracting the virus.
We will at this point bring you a chart that we had with Dr. Happiness Ntia on the causes of hepatitis. Doctor, let's go straight to the point. What are actually the causes of hepatitis?
There is a whole array of things that can cause hepatitis, but the common one we have around us is hepatitis B. Hepatitis B that we can get from any source, as long as you just get your body fluid in contact with the person who is infected, you easily become infected. Hepatitis C, hepatitis D, hepatitis A, bacterial infections of any form you can think of. There are organic problems that can secondarily affect the liver. I told you there are obstructive diseases that can obstruct the drainage of the liver vessels that the liver cells will start reacting to. I also mentioned that some drugs that people take can become toxic to the liver. Alcoholism, chronic alcoholism can cause hepatitis. Now, smoking can cause other problems in the body that the liver may be secondarily affected, not directly following smoking. These are the various causes, and then I don't want to mention cancer of the liver, because if cancer in the liver comes, then it is too bad for us because we don't have cure right now. And then for inheritance, yes, there are certain genetic conditions that people can inherit that can predispose you to liver problems. So it can be inherited. It's not necessarily only bacterial, viral.
Okay, thank you very much, Doctor. From your explanation, does it mean that hepatitis is contagious?
For the viral ones, yes. I mentioned hepatitis B, hepatitis C and D, especially in this era where we are giving people blood, we are giving organ transplant, people are having intercourse without protective measures, and people had not even screened themselves to know if you are a carrier, because you may be a carrier of hepatitis without knowing, and you keep on distributing it, as well as people who are cooking you cook food there, you are infected, you are a carrier, but you don't come down with the illness itself. But as you sell this food to people, some people may become infected.
So let's explain the carrier here and those infected.
The carrier is someone who has this infection, maybe the hepatitis B. It is quiet in the blood, so he does not come down with fever, weakness, yellowness of the eyes. Nothing is wrong with this person. But by the time this person now come in contact with another person, very close contact, I mentioned body fluid exchange. Maybe you have a small wound here and that person's blood just touch you, you just easily become infected, and now the person who is now infected can now come down with the presentations of this weakness.
All right, thank you very much, doctor. Before you go, any last word for those that maybe presented the disease, those that may not even know they have it, and all of that?
Now, I would like to tell you that hepatitis is here, is with us. Some are due to what we do, our lifestyle. It is not a death sentence. It is not expensive to screen yourself for hepatitis and know how to live without hepatitis. Please go and meet your doctor. You will be advised more. Thank you so much for being there.
Well, thank you very much, Dr. Happiness Ntiamos. Thank you for your time. We will, at this point, bring you a chart that we had with Dr. Happiness Ntia on the causes of hepatitis. Okay, very well. In case you've just joined us, you're on to Healthy Lifestyle Africa, and today we're looking at hepatitis and lifestyle. I'd like to remind you our numbers in case you want to contribute to the program or find out about certain things about the program. You can send a short message to 08036755958 to participate. Please do not call. Please, you don't need to flash. Just send a short message. Well, I still have a lifestyle expert in the house, and we're looking at hepatitis and lifestyle. So how can we all avoid all of this we're talking about?
Okay, the first thing I would recommend is to do checkup from time to time, which we have always advocated. This program is about preventive health. Raise alarm that you need to check yourself from time to time. Do screening, check yourself to know that you don't have the virus, you don't have hepatitis. The second thing is to get vaccinated from time to time. You get vaccinated against the hepatitis. So when you are vaccinated, there are different phase of vaccinations. So when they are out, governments usually have their health centers where you can go there, walk in there, and get vaccinated. So that's another thing. Then you need to watch your lifestyle. You need to be very careful what you use on yourself. For example, you need to take a transfusion. Be very sure that it goes through the
normal
medical,
screening.
the proper screening before they use it on you. So these are some of the things that one should bear in mind.
Okay, just before we go on the show, any other information about hepatitis?
Okay, hepatitis is deadly. Hepatitis is real, and people have to be very careful. They need to get vaccinated, and they need to check themselves from time to time. And as well, they need to be very careful, very, very careful to avoid using unsterilized equipment on themselves for whatever reason.
All right, very well. We'll try to leave it at that for today on hepatitis and lifestyle. I'd like to say a big thank you to Asiupo Diagnostic and Medical Center at Medislesa Avenue for sponsoring the program, and of course, the lifestyle expert, Mr. Sunday Kemen, for coming around. Many thanks for coming around.
It's my pleasure to be here. Thank you.
All right, on behalf of the program, producer Stella Ifio, my name is Erim Ega, saying you need to be wealthy, you need to be healthy, you need to be wise. See you next week.